was a trial called the Landmark DASH trial, and in this trial, 459 adults were randomized to a control diet or a DASH diet, and what they found was you had two types of groups. You had people with normal blood pressure, and you also had people with high blood pressure. In the group with normal blood pressure, the DASH diet reduced their systolic, which is the top number, by 5.5, and diastolic, which is the smaller bottom number, by 3 millimeters of mercury. But in those clients who had high blood pressure, the DASH diet reduced the systolic by 11.4 millimeters of mercury and the diastolic by about 5.5 millimeters of mercury. Now, notice that this is a significant reduction in blood pressure. When we give you first-line medication for blood pressure, that could be Norvasc or amlodipine, which is a calcium channel blocker, or it could be something like candesartan, irbesartan, losartan, which is an ARB, or a cousin drug of that, which is something like lisinopril, ramipril, which is an ACE inhibitor. When we get to the maximum dose, that would be, for example, 10 milligrams of amlodipine, or 10 milligrams of ramipril, or 32 milligrams of candesartan, then what we're expecting is 10 millimeters of mercury reduction in systolic and a 5 millimeters of mercury reduction in diastolic. So just by changing diet, the effect on blood pressure was equivalent to the maximum dose of a first-line blood pressure medication. But what happens if you combine a DASH diet with a low sodium intake as well? So this study was published in the New England Journal of Medicine, randomized controlled trial, 30 days crossover. The control group have what you can describe as a SAD diet, which stands for Standard American Diet, high saturated fat, high refined grains, high ultra processed foods. And they rotated through different levels of sodium intake, and what they found was there was an additional benefit with a low sodium diet with a significant reduction in blood pressure. With that,